Good morning, everyone. I am Michaela Miches Viva from BSN 21, and today I'm going to tackle about the bronchopulmonary dysplasia. So before I proceed to my report, I would like to say sorry for the interruption of noise, and I hope it won't bother you from learning. So as we proceed, for the definition, bronchopulmonary dysplasia, or BPD, also known as chronic lung disease, occurs in 10% to 40% of infants who are treated for acute respiratory distress in the first days of life. So this condition most often occurs in infants who received mechanical ventilation for respiratory distress syndrome at birth and gradually improved after 2 to 4 months of supplemental oxygen or assisted ventilation. So as we all know, acute respiratory distress is seen soon after birth and worsens during the first few hours of life. So it happens when a baby's lungs are not fully developed and cannot provide enough oxygen, causing breathing difficulties. So it usually affects premature babies. So next is we have here an illustration of a premature baby who has a normal or healthy lung tissue and along with BPD. As we all know, BPD is a form of chronic lung disease that affects newborn. So as what I have said earlier, most often who are born prematurely and need oxygen therapy. So in this illustration, to the lungs with BPD, the airways or the bronchi are damaged, causing tissue destruction or what we call the dysplasia in the tiny air sacs of the lungs, or what we call the alveoli, that causing difficulty of delivering oxygen. So infants gradually improve after 2 to 4 months of supplemental oxygen or assisted ventilation for those baby who has a bronchopulmonary dysplasia. Here are the causes of BPD. It is the results of a newborn's lungs not developing normally while the baby is growing in the womb of the mother, or not developing fully if the baby was born premature. Babies with BPD have fragile lungs that can be easily irritated or inflamed after birth. For the risk factor, we have here a combination of surfactant deficiency or the decreased from lung trauma, barotrauma, lung damage from the ventilator pressure, oxygen toxicity from high levels needed to counteract the original respiratory distress, continuing inflammation, and for those infants born weighing less than 1,000 grams. So infants with BPD develop tachypnea. So when we say tachypnea, it is a abnormally shallow breathing, retractions. It happens when your child's chest will appear to sink in just below the neck or under her breastbone with each breath. So this is another way of trying to bring more air into her lungs. Nasal flaring occurs when the nostrils widen while breathing, so it is often a sign of a trouble breathing. Tachycardia. Tachycardia is when your resting heart rate is more than 160 beats per minute. Oxygen dependence, abnormal radiographs finding that shows areas of overinflation, inflammation, and anaphylaxis. So next is the clinical course ranges from a mild need for increased oxygen requirements that will gradually resolve over a few months to severe disease requiring chronic tracheostomy and mechanical ventilation for as long as the first 2 years of life. A respiratory infection greatly comprises the infant's ability to breathe. So for the nursing intervention, we have here the 2 interventions that can be administered in preterm infant or preterm fetus. We have here the corticosteroids. It promotes lung maturity, and surfactant, for it promotes alveolar stability. So administration of corticosteroid, it is to reduce the inflammation, and a bronchodilator by nebulizer greatly improves respiratory function. corticosteroids such as dexamethasone and hydrocortisone have proven beneficial for the prevention and management of BPD. So there is no specific cure for BPD. But treatment focuses on minimizing further lung damage and providing support for the infant's lungs, allowing them to heal and grow. So newborns suffering from BPDs are frequently treated in a hospital setting where they can be continuously monitored. Infants need to be monitored carefully for nutrition and fluid intake, especially if ventilator dependent. So ventilator, it is a life support machine that helps you breathe if you can no longer breathe on your own. This machine provides oxygen to your lungs through a tube. So the tube enters your mouth and goes down on your throat to your lungs. Okay, so because of the long hospitalization involved, parents need support to continue to visit and care for the child as what seemed to be a miracle at birth. So the SGA, or the small for gestational age, becomes years of specialized and expensive healthcare. That would be all for my report. I hope you have gained knowledge about my report. So any questions and clarifications, just comment down below for I will answer it right away. Okay, thank you. Next is I will be giving you a questions for the first 5 student nurses who will be answering it immediately. I will be giving a prizes. So for the first question, what is the other name for BPD? Next is BPD gradually improves after blank to blank months of supplemental oxygen or assisted ventilation. For the third question, what are the 2 interventions that can be administered to the preterm infant and preterm fetus? So for the first 5 person who will be answering it, my 3 questions, I will be giving prizes. That would be all, everyone. Thank you so much for listening.